Hello, welcome. Cheers. Adam, we don't get to see your face.
Hi, everybody.
Hello.
Hi.
Hi, Dina.
Yes. It's so funny. For some reason, the computer she uses, they can't hear her on Zoom. So I let her use mine. But her teacher is very specific in making sure that they can see the kid's name.
Yeah.
So she was changing it, but she forgets to change it back.
So I have a question for you before we get started.
Okay.
Everyone can maybe tell me what they think. Does this sound better, or is this clear?
Say
Check
something.
1, 2. Okay. All right, so you get started?
Go
Me
ahead.
now?
Yeah. Thank you so much, by the way.
Hi, everybody. Most of you know me, so but just in case, Yael Alfasi, I'm a pediatrician here in Savannah. I work at Curtis Cooper. So the purpose of this is to hopefully give you guys some information about what's going on in Savannah, what's going on with coronavirus. If you have, I want this to be interactive, so because there's a lot of information out there. So I'm not sure, you know, I want you to help guide me. If you have any questions or anything, please either choose the raise hand or unmute yourself or something. But I'll just kind of start at the beginning, explaining a little bit what coronavirus is, just like the basics, and then kind of building from there. But again, you help me, so you guide me in what you want to know, and I'll give you the best answers that I have. I don't have all the answers because it is a new virus and we're all learning things as we go. So first of all, just basic, viruses are everywhere. They're very, very small. Coronavirus is not an exception. If you would take the tip, just like if you would pull one little hair out and look at the tip of your hair, there's about 1,000 little viruses that can live of coronaviruses that can live on the tip of your hair follicle. So that is how small coronavirus is. Viruses are protein and they're made out of DNA and RNA. They're smaller than bacteria, which is why they can kind of float in the air and be transmitted through droplets, but they need a host to survive. So coronavirus, everyone is now knowing about it. It's a very popular virus these days, but there's lots of them already around. So we have had exposure to coronavirus already. There's about 5 that we get throughout the year. Kids get them mostly, and they usually cause, runny nose and cough and a little bit of a fever, maybe a little rash here and there, but just an upper respiratory tract infection. Nothing that we're usually very concerned about. There have been 2 coronaviruses that we have been concerned about in the past, and that's SARS and MERS. I'm sure we've all heard of them. We've been able to control those pretty easily, mostly because they're not as contagious as this COVID-19. So they were more fatal, their mortality rate was higher, but their contagiousness was less. So we were able to kind of contain them a lot faster. COVID-19 is something new. And so one of the things that we're discovering when it first came out is a lot of doctors and scientists thought that it was mostly a lower respiratory tract infection. And people would have fevers and dry cough and shortness of breath. But with time, we're noticing that this is, in the medical community, where everyone's just referring to it as a beast of a virus. It's not following the rules. So not is it just not causing fever and cough and for some people, some runny nose or sore throat, but it's attacking different systems. So usually viruses focus on the lungs and the respiratory tract and the nose. But we're finding that with COVID-19, it's affecting a whole bunch of systems, all the way from neurological. So it's affecting your sense of smell, which when you get the flu, you would have a sense of, your sense of smell is less, but it's usually because you're so full of mucus that you can't smell or taste your food. But this is different because it's actually affecting something in the brain. And people have no smell or no taste without having all the nasal drainage. The other thing that coronavirus is attacking is the endothelial, so the lining of the cells, and we're finding that it's attacking the blood vessels, the GI tract, like the lining of the GI tract, and so people are getting really bad abdominal pain and diarrhea. But they're also now developing clots. So again, things that we haven't seen with regular viruses. They're noticing now that strokes are happening in younger individuals, like in 30 and 40-year-olds. They're noticing people are having more DVTs, which are clots usually in your calves, which risk moving up to your lungs. They're finding that people are getting lots of clots in their lungs as well, which is why they're having difficulty in the ICU treating patients. So this is a whole new virus and we're learning new things. Being in the medical community, I have the opportunity of getting information as it comes out, and it's literally every day there's 3 or 4 new articles about what they're finding. And so we're just learning as we go. So the other thing that with coronavirus is we don't have a treatment yet. So a lot of what we're doing right now with this whole flattening the curve and staying home is we're trying to kind of postpone a lot of people getting sick until we figure this out. So hopefully, if enough people stay home and we can figure out this virus, that when people start to go out, we have a treatment option. We're not just flying blindly. Right now, there are no medications recommended. It's just supportive care. Physicians are trying different things in the hospitals to try to help lessen the symptoms of coronavirus, but it's still, everything is in trial mode right now. So I guess coming back to coronavirus in Georgia, the numbers for today, we have about 26,000 cases in Georgia, and we have a little over 1,100 mortalities, deaths. In Chatham County, we have 200 and as of 12 o'clock. So if you don't know, you can log on to the DPH. Oh, everyone's joining. Hi, everyone. You can log on to dph.org, which is the Department of Health for Georgia. Every day at 12 o'clock and at 7 o'clock, they update their numbers. I don't know if you've been checking, but I have every day. And today, as of noon, there have been 223 cases in Chatham County. And just from yesterday, we went from 7 to 9 deaths. So, you know, it's something that we're watching. Originally, we thought our peak in Chatham County was going to come by May 14th, which is in 2 weeks. But now, because of now that restaurants are going to be open, we're thinking that our peak is actually going to come a little bit later than that. So let me see, what else can we talk about? So it's important to remember that with coronavirus, most people will have mild symptoms. So about 80% of people who have coronavirus will get a little fever, a cough, maybe feel bad for a couple of days and then recover. 25% of up to 20, they're thinking 25 to 40% of those will actually be asymptomatic, meaning that they have no symptoms. They get the virus, the body is able to fight the virus, and they're just usually walking around. Those are the people that are the silent spreaders. So those are the people that we're worried about, which is why we're asking people to wear masks. Those are the ones who are going out to the stores and they're touching things, or they're talking, or they're coughing, and in turn, they're spreading the virus. So those are those are the scary people that are out there, because they're the ones who can really be what's either silent spreaders and super spreaders. So we want to make sure that, you know, we educate people and know what they're facing. Now, so I said 80% of people will be usually fine. 20% will get pretty sick. Right now, coronavirus, we don't know what the mortality rate is, because we still need to figure out how many people are asymptomatic. So that denominator number at the bottom, as it gets bigger, the mortality will start to drop. But we're thinking that the mortality rate in coronavirus is about 2 to 3%. And if you compare that to flu is about 0.1%. So it's a significantly higher mortality rate. And obviously those who are older or have other health factors, such as diabetes or hypertension or asthma or immune deficiencies, they tend to have a higher mortality rate. So if you're over the age of 65 and you have other medical conditions, you have a higher risk factor. And I guess I can talk about transmission really quickly. So transmission of coronavirus mostly is through droplets. So that's when, if somebody coughs, the virus is in that mucus, and when you cough, the little microscopic droplets kind of fly off, and they can usually fly about 6 feet, which is why we have told people, hey, when you talk to someone, stay away from 6 to 8 feet to make sure that those droplets don't reach you. But we've also found that coronavirus can also be even in the smaller particles, and they can drift in the air, and those are called aerosolized. And those can stay in the air for a long time. But if you're outside and there's a nice breeze, it's not going to linger, it's not going to stay around. places to be careful of is if you're in a poorly ventilated area, such as a bathroom, actually. Those are one of the highest areas of contagious areas. So you want to make sure that if you're in a bathroom, you close the lid actually before you flush. So there's something to think about. The other way to spread the virus is through fomites. So if you cough into your hand and then you touch something, and then somebody else comes by and touch that same doorknob, and then they touch their face, then now they've become infected. So the biggest thing to remember is just wash your hands. This virus has, the proteins are broken down through soap or rubbing alcohol, or like a sanitizing alcohol. So just remember to always wash your hands for a good 20 seconds to kind of break down the protein encapsulation of the virus. And that's the best thing that anybody can do. So if you're out at the store and you're grocery shopping, I would suggest wearing a mask to protect yourself and to protect others, because you never know if you have it. And then if you were to go and touch something, just make sure that while you're at the grocery store, don't touch your phone. Just kind of keep it in your pocket. And then once you're done your groceries and you come home, then wash your hands really well before handling the stuff again. So just something to kind of be aware of. Does anybody have like a question? And then I'll kind of then go from there. That was a lot of information.
Some people asked, okay, we wash your hands, but can we shower?
Can you shower? Yes, of course you can shower. So yeah, you can of course shower. It's a good thing to shower. So if you're, but you know, at the end of the day, if you have to go to work, if you are exposed to people, yes, I would recommend when you do get home to shower or change clothes. Obviously, if you're in the medical field, you would definitely want to shower at the end of the day. But really all you need to do is just wash your hands really well after you've gone in from outside. A lot of people have asked, like, if I'm outside taking a walk, do I need to wear a mask? No, I don't recommend it. You're outdoors, just don't gather with a whole bunch of people. But if you're going for a nice walk around your neighborhood, you shouldn't need to wear a mask. Just enjoy the walk, enjoy the fresh air. It's good for you. Flo has a question. Oh, can you unmute her?
What?
Okay. Oh.
Shoes by the front door because your shoes keep carrying germs, the virus. Is that true?
So again, you would have to be in an area that has a lot of exposure. So again, if you're working in a hospital, then yes, I would not wear those shoes indoors. But if you're going for a walk outside, you would have to step on that exact spot where somebody coughed, that droplet landed, you put your shoe on it, enough virus attached to your shoe, stayed on it, wasn't killed by sunlight or anything else. Then when you took off your shoe, touch that exact spot and then put it to your nose. So I would say you don't have to, but there have been studies that have shown that shoes are one of the dirtiest things and we shouldn't wear our shoes in the house. So maybe it's a good thing for the South to adopt in general.
How many hours the virus, if you got in your shoes, stay?
Yeah. So the virus can stay in the air. So if it's not a droplet and if it's a small particle, it can stay in the air. They've seen up to 2 to 3 hours. But again, that means that there's no breeze to carry it away. But that also means, like, let's say you're in a restaurant and you're sitting beside somebody and you're there for 45 to 50 minutes and the person next to you is having a conversation with who they're with and they keep talking and they're coughing and they're sneezing and you are now inhaling that. So that would be something to be concerned about. If on surfaces, it doesn't, so in an area where it does live on surfaces, so remote controls, light switches, you know, those kinds of things you would want to sanitize on a regular basis, unless you're the only person who's touching it. But you know, if you're thinking about something outside, like a bench, for example, sunlight does kill viruses. It cannot tolerate heat. So that bench that's sitting out in Forsyth Park, I wouldn't go ahead and lick it, but I would, that would be just gross. But I would, you can have a seat and and that would be fine. And then, trying to maybe keep your hands on your lap. And then I think those are okay things. If you're going to the grocery store, again, I would say just wash your hands when you get back. I would definitely sanitize the cart that you're handling. So I can tell you what I do when I go to the grocery store. I go with a mask, mostly because I don't want to expose. I'm being responsible for myself. It's not that I'm protecting me. I want to protect you. So you never know if the person that you're shopping next to is a nurse and if she was just taking care of a COVID patient. So, you want to protect yourself, but you also want to protect others. So I wear a mask to the grocery store. Before I leave to go in, I make sure that I know what I'm getting or I have a paper list. I don't touch my phone. I don't touch my keys. I then sanitize my cart if I can, if they give me one. If I have Purell and they don't give me one, I'll put a whole bunch of Purell in my hand and touch the whole cart with it. And then I'll just kind of go grocery shopping, pick out my stuff. If I take out my card, I will take it out, but I won't put it back in my wallet. I'll just put it in my pocket. And then before I go back to the car, I'll again use Purell and sanitize my hands really well. Make sure that you also sanitize your nails underneath, because that's sometimes where the virus likes to live. And then I put everything in the car, drive home, and just try not to touch anything until I get home and wash my hands. You can, if you want to be super cautious, you can wipe down your grocery items, mostly like the boxes. I would not wipe down your fruits with Purell. You can rinse off your apples like you always do. You can rinse off fruits and vegetables like we always did, but we don't have to go crazy. Again, we're finding that your risk is minimal for that. Again, you'd have to remember that the person before you maybe touched it, you touched the same part, then you touched your face. So as long as you don't touch your face, you're okay. And as long as you do, as long as you're smart about it and just be cautious about it.
Okay.
Yeah.
Okay. What about Amazon? Your boxes from Amazon or things like that. Should you wipe them down before you bring them in the house?
Again, that is up to you if it makes you feel more comfortable. Again, I don't think that the virus it doesn't live on paper very well. It doesn't live on cardboard very well. So it's mostly metals. So if you have necklaces and jewelry, I don't wear my rings to work anymore, but that it can live on for several hours, but for paper, it does not live for very long. But
Okay.
What I would recommend is instead of wiping down your box, I would just bring it in, open the box, take it out, and then wash your hands. And that's what I would recommend doing.
Okay, thank you.
Mm-hmm.
Yeah.
Yeah.
Sorry, just for somebody who said they wouldn't be able to come, but they were having a debate and with their husband and they want to listen to this afterwards. The efficiency of all the homemade masks. He is of they don't have the special filter. We might as well not even use them. And she is obviously something is better than nothing. So
yeah.
you
So I agree that something is better than nothing. For little kids, it doesn't help because they end up touching the mask all the time. For adults, I feel like it makes you aware of your face and maybe that it just kind of reminds you the time that we're in and that maybe you would touch your face less. I was going to say I have, one second, I'm right here. I have several ones that I've made for my daughters. So they haven't worn them yet, but I feel like it is important because it does, let's say you were to cough, it will stop those large droplets from spreading. Or if you were to sneeze, it will stop those large droplets from spreading. If you're just talking at a regular level, You know, it is stopping your breath a little bit, but you are able to breathe in those particles. So it's mostly to protect the other person, not really yourself. So I think I would say that I would do it. Also, the best filter to use in these masks is those blue drying towels for cars. Like you can buy them at Home Depot and whatever, just like the blue towels. Those are actually really good. You can cut two and put them together, and that would serve as just as well as a filter as a surgical mask. So that's what I would recommend for use. I mean, I think using a mask is important right now, because it's no longer really about us. I would like to say that if you are I know that Georgia has lifted a lot of its social distancing rules, and we're reopening restaurants and movie theaters. I would say that if you are in a category of being at risk, I would continue to stay home as much as you can. I would continue to have maybe groceries delivered to you, or using the early shopping hours if you can, or having someone do the grocery shopping for you. Because we're going to hit a second wave in a couple of weeks, and that's when we're going to see our numbers go up. And we don't know yet if the virus is going to be seasonal. So maybe maybe by June, July, this will kind of die down because of the heat, or we don't know if it's just going to keep progressing, or if it's going to take a break and then come back in the fall. So we're all just kind of waiting and seeing what's going to happen. Does anybody on here have little grandkids or children, or you have children, Dina? Like not Dina, but Orly.
Children.
So with
in Israel, you're right. Now the doctors and the nurses working with hijab.
yeah, to be all covered.
They say they like this. They call like hijab. They said the mask, but they have to cover because of when people sneezing like this, with working with sick people like this to protect themselves.
Yeah, to cover their hair and stuff. But if you have grandchildren, kids don't usually spread. They don't usually get as sick, but they are possible spreaders. And studies have shown that they can spread the virus through their stool for up to 30 days. So if you have grandchildren and you need to wipe them, I would definitely wash your hands. So, because 30 days is a long time to be shedding, 30 days to shed the virus. But you know, the question now is, should kids go back to school and things like that? And so there is a potential of this being spread faster. So this is a time to be really, really careful and to be very, very prudent and very safe. So we kind of had it easy the last couple of weeks because everybody's been home. But once everybody starts to come back out, that's when we need to be really careful. Orly, did you have any other questions?
When they will reopen the schools?
So in Georgia, it's not going to reopen until August, until the next school year. We're closed. Other places in the north, they're considering opening. I know Canada is opening schools back up in next week. So everyone is different, but I think we're going to stay closed for a little bit longer, and then we'll reevaluate in August. So. How long is this going to go on for? It was the question my mom had. I don't know. I don't know. Yeah.
Back on the grandchildren question, everyone's talking about picking a date when they're going to see touch their grandchildren again. Why is one date any better or any less arbitrary than another date? I mean, what's the difference between May 15th and June 1st? And somebody, posted this week that they brought their kids back over to their grandparents. I mean, is it really just now personal choice?
Yes. So, a couple of things on that. I think one is your comfort level, and you know, there is no clear answer to this. But if a family has been quarantined for more than 14 days and they've only been in contact with their family, and they haven't had any symptoms, then it's, you know, at that point they're safe to interact. Now, if they were to go out and expose themselves and be going to restaurants and the theaters, then their risk then goes up again, and you would have to quarantine again. But, you know, we have to remember in other places, like if you go, when my brother traveled back to Hong Kong, he quarantined himself for 14 days. And then once he had no symptoms from flying, from being on the airlines, he considered himself to be safe again to kind of go out. So, so it's important to, like, I would say that, you know, I know in your circumstance, you have, you know, if you have a son-in-law who's in the medical field, so that makes it dangerous. And so, but if it were simply just to see the kiddos who are home all the time, they would be safe, but the problem is their exposure to their dad who works in the medical field. It really is a matter of your comfort, and the risk you're willing to take for that grandchild hug. I don't know. It's a hard decision. It's really a hard decision because this may be a long-term scenario, and we need human contact, and we, you know, that's important. And so you have to decide for yourself, if, you know, one meeting a week with outdoors, maybe at the beach or something, or somewhere where it's open air, without a lot of people around, if that's a safe scenario for you to see the grandchildren.
Yeah, the parents right now are more strict than the grandparents.
Yeah, I know. Well, you know, for example, for me and my parents, for their safety, I have gotten a babysitter to watch the girls, so that they are only exposed to them one day a week. And people would argue, well, that's one day. What does it matter? I mean, but it gives me 6 other days to make sure that they're symptom free. So, and then they still get to see their grandkids, and they love that. So I don't, you know, if this is going to go on for 6 months to a year before we can get a vaccine or a treatment, I don't know if we can go a whole year without seeing our little beans around.
Vaccines, there's nothing sacred about a vaccine. I mean, we have,
Yeah. You know,
we're mean 0 cases.
Exactly. I think the biggest thing that we're looking for, I think what I am personally waiting for is a treatment plan. So once we know what this thing is and how to reduce the mortality rate, then my comfort level will increase a little bit. My concern right now is that you don't know. I mean, you're literally rolling the die. Like, are you going to be super, super sick? Will you have a stroke? Will you just have a runny nose and a cough? Will you end up, you know, in the ICU? Like, this virus there's nothing to predict what it's going to do. So I'm going to keep my guard up and I'm not going to go to restaurants, and I'm going to do as much grocery delivery as I can until physicians out there come up with a treatment plan and say, we have found this medicine that works, and we have found that this treatment in the ICU works, and we have figured out why this virus is such a beast. Yeah, go ahead.
Flo, go ahead.
All right. I see on Facebook that they're advertising for people to become guinea pigs for certain, like Meridian clinical trials for a vaccine. Is it safe? You know, they're advertising. A lot of people I know some people in my senior center have signed up for things like that. Is it safe? Could you actually spread something that they put in your body to somebody else?
So usually vaccines take about 10 years to manufacture and test and make sure that there are no serious side effects. But when something like this hits and it's causing a high mortality rate, they will kind of not cut corners, but they will speed things up. is there a risk? Yes. You know, I think the first person who ever got inoculated with the vaccine is a med student or a resident. He's like 33. He doesn't have any past medical conditions, but he knows that there is a risk. There is, and with any vaccine, there is a risk. The biggest risk is what they call Guillain-Barré, which is where you start to get paralysis.
Yeah.
And that's a risk in any vaccine. So, you know, I would say for most people to not go ahead, you know, if you're healthy and you're young and you understand the risk factors and you want to participate, then okay. But for most people, I think we'll just be waiting for the vaccine, hopefully, to come out. And hopefully we can figure out a vaccine, because there are a lot of things we don't have vaccines for, and we're still trying to figure out.
Yeah, can you talk a little bit as a medical professional on Savannah in general? Like, how is Savannah handling this? And
Yeah.
you feel that the doctors and the hospitals here are prepared compared to like other places in the country?
Yeah. So I feel like we've caught up. So at first we were kind of dragging our feet, and I think it's just because we were a little bit in denial that this was going to actually happen. But we have testing capabilities. The turnaround time is still about 2 to 3 days, which is not too bad. 2 to 3 business days, not regular days. So if you go on a Friday, you'll get your results on Tuesday. And most hospitals have created extra capacity. And I think we are okay on our protective equipment. But I also wanted to make sure to say something, which is, thank you actually, Orly, for mentioning it. ER doctors are seeing a huge decrease, about a 20 to 30% decrease in visits, including like strokes and heart attacks. And it's not like people have stopped having strokes and heart attacks. It's just people are not thinking that it's bad enough, or they're putting off their symptoms before going to the ER because they're afraid that if they go to the emergency room, they'll be exposed to coronavirus. So one of the things people want to say is, if you have any sicknesses or ailments or pains, or call your doctor and see if they'll have a televisit set up for you. And then from there, if they feel like it's serious, then they will direct you to the emergency room. And ERs have a COVID section and a healthy section. So you're not going to be exposed to coronavirus if you go. But I feel like Savannah's pretty well prepared at this point. I know that Candler and St. Joseph's, I think St. Joseph's has about 5 coronavirus patients currently and 3 with people under investigation. And then Candler has currently 1 and 1. So those numbers change from day to day. But yeah, we're seeing a little uptick in the amount of cases in the last couple of days. So, but I think we're prepared. I don't know how many beds we have currently, because I know they've paused the amounts of elective procedures, but they have restarted those right now. Yeah.
And I know that you talked about the mortality rate and the symptoms, but I know that a lot of people are so, like you said, they're hesitating to go to hospitals because they're worried about, if I get it.
Mm-hmm.
It's not, can you, like, I know that some people are like, if I get it, I'm going to die. Like, that's not necessarily what's going to happen. And
no, so like I was saying, 80% of people will be fine. Like, that's a big majority of people. And then the other 20%, 17 of, like, most of so now there's 20% left over. Most of those people will get pretty sick. But they'll be fine. I mean, they'll have like a really rough week or 2, but they'll be okay. And then the last few percentage will get very sick and will need hospitalization and will need to have lots of care. And unfortunately, some people, won't make it. But we have to remember that most people will be okay. And if you are, so one of the things that we're discovering is, so if you get a fever and you get a cough, the one thing that they're saying is just be aware 7 to 10 days after those symptoms, that's when some of the other symptoms may pop up that you may not think about. So possible like skin rashes or like sores on your fingers and toes might happen. Again, if you're young, you may get signs of a stroke. So you may get like a little bit of arm weakness or numbness, or slurred speech, things like to remember. So it's just good to have in the back of your mind. And it's an ever evolving illness and disease. So information is going to keep coming out. And I'll be happy to provide some really cool podcasts that are coming out. So for the general public to kind of get information on coronavirus, and it covers the podcast I love. It covers everything from should I wipe my groceries to how long does it live on surfaces to, you know, what's the mortality rate like, and maybe even how long this is going on for. So it's a good resource to have.
Awesome.
I have a question. I have a question because maybe I'm not sure, but maybe 10 or 20% of Americans have no insurance at all. What happens if they go to the hospital? I think maybe they are sick and don't want to go to the hospital, and I guess they don't have the real number because they don't know because they are not covered, or they can be covered if they go to the hospital. There's a question.
Yeah, it's a good question. I don't know, and that's the big issue in the U.S. and the reason why our cases may go crazy is because some people may not go to the hospital if they're sick because they don't have insurance, or they may put off their symptoms. So, you know, yeah, it's a good question. There's no answer. I don't know who pays the bill at the end for coronavirus. That's up in the air.
You have to ask Mr. Trump what happened. It can be a very disaster for the country.
Well, I mean, we're all seeing what's happening. So, but medically wise, we're going to treat people at the hospital, regardless if they're insured or not. And then from there, we will figure things out. So, are there any other questions? I have a telehealth visit that's starting soon.
That's important.
Any other question?
I not a question. I have to tell you something. What happened? I heard yesterday. A family went to the beach and they have $2,400 tickets because they went in Tahiti.
Did they sit down?
I don't know, but because they said the people of Tahiti complained and the police come and give a ticket.
Plus it was closed.
Yeah, well, the beaches are open for exercise. So
But
you can't sit down.
Yeah, but the beach there, because it was in the paper, with Richmond Hill, they climbed over barricades and stuff like that. So
Okay, they didn't go through the entryways that were designated.
Yeah.
Okay, that makes sense. Okay.
If you can run, you can go to the beach.
Well, if you guys have any other questions, please let Orly know and she will direct them to me. I'll be happy to answer them. And obviously, you know, this is evolving. Hi, Charlie. So obviously this is evolving. And so as we get more information, we'll be happy to give you as much information as I can.
Thank you very much, Yael, for your time.
Anytime.
I have a question for Orly.
Sure.
How the health of our community? You have
The health of our community?
Yeah.
Which community specifically? The broader community, the Jewish community, the AA community?
The people of GA and AA, how they have any people sick?
No, as far as I know, thank God, everybody is in good health, and we do not know of anybody currently that is sick or exposed to the virus that we know.
Thank you for the information. It's good.
Because we have no information from any people, just the ones we call.
Well, feel free to call. We have phones. We'll talk to you. I mean, and if not, we'll let you talk to Noah. He'll talk to him.
Exactly.
So, all right. Thank you very much, Yael.
Bye, guys. Thank
everybody.
you. Thank you.
Bye.